Here are some tips on how to properly perform a pinwheel assessment. Hi everybody, my name is Dr. Perman. I'm a board-certified chiropractic neurologist and I focus primarily on rehabilitative techniques for concussions, migraines, and dizziness. Okay, so I teach neurological examination here at the college where we go over basic sensory testing, motor testing, reflex testing, and a bunch of other neurological examinations as well. I wanted to dig deeper into how we properly perform sensory examinations, more specifically how we perform a pinwheel assessment. Now, a pinwheel assessment is going to be using a tool like this where we have a pinwheel with spikes on it. And the purpose of this is to elicit a little bit of pain, to test a tract in our spinal cord known as the lateral spinothalamic tract. And this is the tract that carries pain and temperature information up into the brain. Now, this is a contralateral tract, which means if I am testing pinprick sensation on the right arm, I am testing the left lateral spinothalamic tract. Now, as far as how to properly perform these examinations, there are a few things that you need to know. First off, we need to make sure that we are using a fresh, new, sterilized pinwheel every single time we're working on a patient. Now, the easiest way to do this is just by using a disposable pinwheel. You have your one-time use pinwheel, you open it up, you utilize it as many times as you need to for that one examination, and then you throw it out. Now, they do make metal pinwheels that you can use as well. You can use a metal pinwheel if you'd like, but you have to make sure that you're sterilizing it between every single use. So make sure that you have either a UV sterilizer or an alcohol bath to clean your equipment in, or both. But for here, we have our disposable ones. We just use the disposable ones. Next, we need to learn how to properly use our pinwheel. So here we are. The pinwheel is sharp. It has all these spikes. It is not a super pleasant thing, and it can be a little bit scary for a patient to see this pinwheel coming at them. So we need to make sure that, one, we're making the patient feel comfortable. If you just come at them with this pinwheel and start rolling it all over them, they're going to be a little bit freaked out. So before you begin with your sensory examination, it's important that you say, hey patient, this is a pinwheel. We're going to run this along your skin to test your sensation. Now, it's going to be a little prickly, but it shouldn't hurt. We have to make sure that we're not hurting our patients when we do this. They should just feel a little bit of a prickly sensation as they run the pinwheel, which leads me to my next point. We need to make sure when we're using our pinwheel that we're not pushing too hard. It doesn't require a lot of force to elicit the pinprick response. Now, all we have to do is lay the weight of the pinwheel on and roll. The large majority of people, just with the weight of the pinwheel and rolling, that is enough for them to feel the pinprick sensation that we're going for here. Now, in the event that you roll this on them and they just feel pressure, you're gonna push a little bit more, just a tiny bit of pressure to elicit that pinprick response. Now, if you're seeing a row of white dots pop up behind your pinwheel, you are probably pressing too hard, so definitely lighten up a little bit if you're seeing that. Next, for a pinwheel test, it's very important that we are directly on the skin. We have to make sure that we're on the skin so that the patient is actually feeling the sensation of the pinprick. If we're going through clothes, that will suppress the sharpness of the device, which can affect your test. So make sure that you are directly on the skin when you perform these assessments. Next, we have to make sure that when we're doing these assessments that the patient's eyes are closed the entire time. We have to remember patients are going to fake their way through your examination whenever they can. So we have to take as many variables out of the equation as we can. So by having the patient's eyes closed while you do the sensory examination, it makes it so that they can't pretend that they felt something that they didn't actually feel. And lastly, we have to remember that this is a comparison from side to side. So we're picking one dermatome to work on, and we are going to compare that dermatome on this side to that same dermatome on the other side. So we're looking for discrepancies in how much you feel the sensation from side to side, and then we're always going to note the side of diminished function. Now, that doesn't mean that the side of diminished function is the side of the problem. It is possible to have hypersensitivities to pain, which might be the actual issue, but to keep things standard, we, in our notes, are always going to note the side of diminished function, even if that diminished side is not the main issue. Now, in order to determine which side is the problem, if you do have a discrepancy, that is when you're going to test dermatomes against adjacent dermatomes. So if I feel like I have diminished sensation on the C6 dermatome on my right side, I'm then going to test the C5 dermatome on that right side versus the C7 dermatome on that right side to see if there's a difference between that C6 dermatome on that side and those other dermatomes. If they feel the same, it's likely that the other side is the problem. So when you have that discrepancy, one side feels it more or less than the other, make sure you then test the dermatomes around that dysfunctional dermatome on each side so you can really see where the imbalance actually is. Please be on the lookout for future videos where we will dig into how to specifically perform a pinwheel assessment on each specific dermatome. But if you have any questions about pinwheel testing in general, please leave a comment below or reach out and we're happy to chat with you further about it.